So I'd like to now introduce Patricia Bruno. And Wayne, can you help get up her talk? So Patricia and I have worked together for almost 20 years. She's the epilepsy nurse coordinator here, and she is as equally obsessed with sunflower as I am. And she's going to talk to us about treatments for sunflower syndrome, including our experience with fenfluramine. So.
Good morning. Thanks for coming. We're excited you're here. So I'm going to talk about treatment approaches to sunflower syndrome. And I'm just going to give a shout out to my sister-in-law, Andrea, who painted this beautiful painting in honor of all of you. So I'm going to talk about the pharmacologic treatments, which include the typical anti-seizure medications that are, commonly used. Then we're going to talk about a little bit our clinical research that we did using another medication called fenfluramine, and then we'll just go over the properties of fenfluramine and things to know about it. And then we'll just touch on the non-pharmacologic treatments. So sunflower syndrome, as we know, is considered a photosensitive reflex epilepsy. It is classified as a generalized epilepsy, so not a focal onset epilepsy. So this helps us figure out which medications are best to use in these situations. So generalized meaning it arises from all areas of the brain as opposed to a one focal area. So you use different medications for different treatment approaches for those types of seizures. So why do we treat? We treat because we recognize that the excessive hand waving, a couple of hand waves here and there are not a problem, but when they become excessive and rapid, it sometimes can lead to momentary lapses in awareness and sensorium. Kids are a little off balance. It can create short-term memory loss in school. We worry about safety. Someone's hand waving if they're walking across the street. They're not, really focused on what's happening at the time. And we worry about bullying because kids do get bullied in school, and Emma and Lee will touch on that a little bit later. We also treat to prevent the tonic-clonic seizures, which in our research trial that Dr. Teal was talking about, the RED-CAP survey, it recognized that 51% of patients with sunflower syndrome did report a history of tonic-clonic seizures. So the commonly used medications and from that we use, and the ones that we have heard are most effective, and I think in our clinical practice we have sort of recognized that as well. The RED-CAP survey pointed out that 60% of patients were taking Depakote, and that seemed to be the most effective at preventing the hand-waving episodes. During that trial, or during that survey, it was recognized that that 60% became seizure-free with Depakote. Other medications, levetiracetam or Keppra is also a commonly used medication. Lamotrigine, clobazam, and ethosuximide are the top 5 that we are seeing. I'm not going to touch too much on the details of those other medicines, but more information can be found on our website. Dana Dallas, one of our former nurses, did a nice little review of those medications. And this is just a graph showing from the survey. You can see that valproic acid, the gray area, if you can tell, the gray area is the area of positive response. So valproic acid or Depakote is the most. The second one was lamotrigine, and then Keppra behind that. And then dietary therapy, which we'll talk about later, is also very effective. So why do we choose fenfluramine to study? So as Dr. Teal pointed out, Drs. Jana Kargi and Henry Gusteau reported a positive response with fenfluramine in 3 patients with photosensitive epilepsies in the 1980s. And the first patient described, we felt, matched that of sunflower syndrome. So, and because we recognize that all the other medications have not been completely effective, Dr. Teal's theory was that perhaps fenfluramine might be helpful. So we embarked on this journey. The trial, we did the trial in 2 stages, and the first we did in 10 patients each. So the first trial of the first 10 patients, the age range was somewhere between 7.6 and 25.2 years. Again, genders, as we recognize, it's 8 females versus 2 males, which we seem to have more prevalence of females than males recognized with sunflower syndrome. Previous numbers of medications they had tried had been 2.5, and they were currently on about 1.5 each. So the trial design consisted of a 1-month baseline period during which patients were recording their number of hand-waving episodes in a seizure diary, as well as their other seizure types, but we were focused more on the hand-waving episodes for this trial. So they began fenfluramine at the end of this baseline period. It was started up in our sort of the usual fashion that we treat with the medication. You start at a low dose, 0.2 milligrams per kilogram per day, and you increase the dose every 2 weeks to reach a maximum of either 0.7 milligrams per day, or there's a total daily dose of 26 milligrams allowed by the FDA at this point. 9 of the 10 patients completed the trial. 1 patient did withdraw after 3 days on the medication, and that was due to the development of a rash, which was really not thought to be related, but she declined restarting the trial. So our results showed that during the 4-week baseline period, there was a median hand-waving episode number of 55.8 per day, and that was a range of 10 to 230 hand-waving episodes per day. After 3 months with treatment with fenfluramine, that number reduced to 9 per day, with an average, a range of 0.3 to 136. So overall, that computed to a 79% median reduction in hand-waving episodes, and our goal was to reduce 30% or greater. These patients were considered responders, which is a typical formulation used by companies when you're developing new medications. For epilepsy, if it's more than a 30% response, it's considered a responder. So 8 of the 9 patients were really good responders. 6 had an over 70% reduction. 3 of those had greater than 90% reduction, and 1 patient had a slight increase of about 13% of hand-waving episodes during the trial. And this is just showing a graph of the decrease over time. So we were very excited to see this. And then Cohort 2, we were given permission to enroll an additional 10 patients, and this unfortunately occurred during COVID, so this is a little bit more challenging. We were mailing medication, emailing, having Zoom calls with patients throughout this time. Of the 10, 8 really were able to be analyzed. The other 2, I think there were various reasons why we just didn't get enough data, and we felt like it would not be contributable to the data that we wanted. So these children were between age 6 to 13 years, and again, 7 females and 3 males. And with this result was not a little bit less than the previous trial. So the mean hand-waving episodes were 57 per day, and they reduced to about 25 per day after treatment, which showed a 33% median reduction in hand-waving frequency. 5 of the 8 patients were considered responders. 5 had greater than 30%, 3 had greater than 50%, and 1 had greater than 70% reduction. So because of this, we're proponents of fenfluramine if other medications are not, helpful. So just to recognize that this medication became approved in June of 2020. Its branded name is Fintepla. Its current indications are for seizures associated with Dravet syndrome and Lennox-Gastaut syndrome, which are 2 other epilepsy syndromes. Their seizure types consist of tonic-clonic, atonic, tonic, myoclonic, absence, and atypical absence. So there's some overlap with sunflower syndrome with the absence and the eyelid myoclonias. The mechanism of action in terms of epilepsy is not well known, but the mechanism of action for the drug itself is that it causes the release of the neurotransmitter serotonin, and it inhibits its reuptake. In terms of safety and tolerability of the medication, the potential adverse reactions include somnolence, sedation, lethargy, decreased appetite, and diarrhea. Mostly what we see in our clinical practice is sometimes a little bit of sedation when first starting, and sometimes a little bit of decreased appetite, but that tends to dissipate over time. So we kind of feel this medication is pretty well tolerated. A few things to note about the medication is that because it acts on serotonin, if you are taking other medications that also act on serotonin, it can cause what's called a serotonin syndrome. This is a syndrome that's associated with increased heart rate, blood pressure instability, agitation, irritability. So for that reason, many medications in terms of classifications that act on the serotonin pathway are contraindicated. These include sort of the common SSRIs, the medications that are used for antidepressants like citalopram or Zoloft, the tricyclic medications, antipsychotics, and interestingly enough, one called dextromethorphan, which is the cough suppressant that is seen in cough and cold preparations. It's the DM of Robitussin DM, so those are things to be aware of and you'd want to avoid if you're taking fenfluramine, and St. John's wort, which people use for various reasons. This medication also comes with what's called a black box warning, and these are black box warnings in medications are classifications of meds that have some potential serious complication and that you want to be aware of, and that they want the physician to be aware of. So this drug was around in the 1960s. And then in 1990s, it became marketed as the medication called fen-phen, which was a diet weight loss drug. And the classification of this medication, it's associated with some cardiac toxicity in terms of thickening of the heart valves, and leading to pulmonary arterial hypertension. In the clinical trials that we did, we were involved in the trials for Dravet syndrome as well as Lennox-Gastaut syndrome from 2016 to 2020. And in that database, this was not seen, which was very, a nice thought and nice, very positive and reassuring for us. So we felt good about moving on with this medication. At this time, the FDA requires a baseline echocardiogram and also requires still that they be, if you're on the medication, that you have an echo every 6 months. And we've really seen no problems. The drug does have a dosing limit, and that is 26 milligrams per day, or based on younger weight of 0.7 milligrams per kilogram per day. And those are set by the FDA, not to go beyond that, and hoping to prevent other complications. So the non-pharmacologic treatments, as the blue tinted contact lenses, which Dr. Steve Cantrell is going to talk about shortly, dietary therapy, and Wing is going to talk about that with the low glycemic index treatment diet that we use. Just practical tips, which I'm sure you're all mostly aware of, wide-brimmed hats, polarized sunglasses, light dimmers. If someone is excessively hand-waving, just nice to sort of gently move them out of the sunlight or the provoking stimulus. And focused activities. We know that when kids are engaged and really, if they're engaged in certain, activities, they tend not to wave. And as far as classroom accommodations, we have tips and, things that we write into our seizure plans for our patients, which include seating away from the window if you can, covers over the bright lights. One of our families here has told us that they got their school to put, particular sort of covers over the ceiling lights that was provoking seizures for her child. Window shades in the classroom, which I don't think all classes have that, but that's something you can request. Having a buddy on the playground or a monitor on the playground to just make sure that if someone is waving excessively, they kind of pay attention to that. We worry that excessive hand waving can lead to tonic-clonic seizures, which we've seen. So thank you.
Thank you very much, Tricia.